Good afternoon, everyone. This is County Executive Pat Ryan. Thanks for joining us for our COVID update. We're going to talk COVID, we're going to talk vaccines, and at the end, very briefly, we're going to give an exciting update about our Universal Basic Income pilot. So thank you again for taking time out of your day. I will say tomorrow is one of my favorite holidays, St. Patrick's Day. So I hope to the degree you possibly can, you can find a way to enjoy that. I did have corned beef and cabbage for lunch today, and we were just talking about Irish soda bread. So all trying to find ways to have some joy and some normalcy in the midst of what's been now more than a year of challenges. But happy early St. Patrick's Day to everybody out there. And hopefully next year we can do our normal big celebration in the city and in the county that a lot of us I know look forward to every year. Diving into the COVID situation, overall, things are holding about the same in terms of COVID infections and COVID status across Ulster County. We are now at 11,802 total cumulative cases since the beginning of the pandemic on March 8th of last year. Total tests delivered, we're approaching 300,000, 298,000 plus right now. Our recoveries of those that have been infected, we are at 9,926. And unfortunately, we do continue to see the fatal impact of COVID in the last few days since my last update. We've had another 3 Ulster County residents succumb to COVID, bringing our fatality count to 237 lives lost, and so many more impacted by that. And so let's please not lose sight of that when we think about our day-to-day actions and decisions. And we're doing everything we can, I know, collectively to stop that. Hospitalizations are actually at the lowest levels we've seen in several months, which is great news. We have 5 currently hospitalized in Ulster County. The one downside is 2 of them are in the ICU on ventilators right now, so please send your love and your positive energy, especially to those 2 fighting right now against the virus. Looking at our active case count, this is one of 2 metrics I'm going to talk about today that give us real pause and real concern. We are seeing our active case count, and I've been talking about this for a week or 2 now, not only actually level off, but since our last update, we've seen the active case count increase a little bit. We're now back up to 1,639 active cases in the county. You can see clearly on the graph we've reached this sort of plateau as we were on the downslope of the second wave. This does mirror the same impact or the same sort of dynamics that are happening in New York City and in other parts of the region and in some other parts of the state. We're still working, and the health experts are still working to really try to ascertain exactly what's going on there. But they believe it's some combination of potential new variant strains that are more contagious, as well as people relaxing a little bit on restrictions. And so those 2 things intersecting are keeping us at a level that's much too high in terms of active case count. And we're seeing that in the second metric that I wanted to talk about, which is the new positive case rate that we look at day over day. Our goal is to get this to 0 or at least to get it under 1%. But right now we are still above 5% and have been for several weeks. Currently in the last 96 hours in Ulster County, we're at 5.43% for new positive cases. That means that in the last 96 hours, we've tested 4,123 residents and had 224 new positive cases, once again putting us at 5.43%. Until we can get that new infection rate down, which is really the snapshot of day at a time, or in this case, 4 days at a time, how many new cases we're still getting. Until we can get that down, that's where we could still continue to see higher active case counts, which just means everybody's at greater risk as you're out and about trying to do the things that you need to do, whether that's economic activity and business or getting our schools back open. So we really have work to do to get that back down. And we need everybody's help and vigilance to do that. In terms of the projections long term, you can see the impacts looking out of what that could mean in terms of the steepness of the curve and total cumulative cases. So once again, please remember that each of our individual decisions in terms of precautions and gatherings and so on have real impact at a ripple effect across the county and across the region. Long-term hospital capacity and treatment capacity, we remain in a good place here. You can see the current numbers, and we have more than sufficient capacity in the medium and long term. Once again, it is very good news to see our hospitalizations now well in the low, mid-single digits for several weeks now, and this is the lowest level we've been. So that is some cause for optimism. But again, the math is simple here. The more active cases we have, the more sicker folks we have who will eventually be hospitalized, and among those, of course, folks who may ultimately succumb to the virus. So it all goes back to slowing that new positive rate and the total number of active cases. We all know how to do that. We've been doing it for over a year. I know it's been exhausting and frustrating and many other adjectives for so many of us. But the things that we have to continue to do individually and collectively are wearing masks, maintaining distance, avoiding gatherings, washing hands, using hand sanitizer. We're getting close to the point, although the weather this week hasn't quite cooperated, but we're getting close to the point where it'll be warmer. We'll be getting into spring. We can do a lot more outdoors, which we saw in the summer did absolutely bring down the infection rates. So if we can just hang on a little bit longer, I know, and we said coming into the winter it was going to be a long and dark and difficult winter, and it has been, but we're getting really, really close to that spring coming. We've had daylight savings time. We got St. Patrick's Day. Those are all the signs. So let's just hang in a little bit longer with these restrictions. And as the vaccination rates get up, continue to grow, the end is definitely in sight, and that makes it even more important to stay cautious until we get to that end. Talking about vaccine progress and allocations in the county, we did get another significant vaccine allocation for the county this week, which is good news. We were across the county allocated 3,770 vaccines. That's between our county health department, pharmacies, hospitals, and medical providers and other partners. I'll talk more about that in a moment. That is slightly down from last week. Last week we were at 4,310. This week we're at 3,770. But effectively it's about the same level as last week. We know we need more. We're all continuing to advocate for more. I will continue to do that. The good news is we have two very significant developments on our vaccine distribution efforts that are starting this week that in my mind mean that next week will be a major inflection point in the county in terms of upping both our supply and our distribution capacity. So that is really, really good news, and I know a long time in the making. So those two new developments, starting on Thursday, we will be moving, or we already are moving out of our Kingston High School pod site, and Thursday we will open up our new primary county vaccination site at the Hudson Valley Mall in the former space that many of us know as the Best Buy location. It's a perfect location in terms of massive amount of space, nearly unlimited parking, easy access for all, in particular for seniors and those with other disability or mobility restrictions. I want to really thank the folks at the mall for working with us on this. I also want to thank Kingston High School Superintendent Padolino, the whole team there, for instantly agreeing to host us at the field house, for working every day, you and your team, to make that site run extremely smoothly, to get tens of thousands of people vaccinated at that site. That was a huge service to our community at such a critical moment, and I want to thank you all. Now that we're working towards hopefully reopening schools soon, it makes sense for us to move out of that location and to a bigger location at the mall. What this also means in terms of our distribution capacity is at the high school site, we could do up to 1,500 doses per day. At the mall location, we can do up to 2,500 doses per day because of more capacity and space and so on. So that means as supply increases from the federal and state governments, we have even more distribution capacity now at our county site. And I'll talk in a moment about the state site as well, which will be another additional complement to that. Here are the, for this week, the locations of Ulster County pods and other partner pods. We'll be doing all of our Ulster County distributions this week at the mall site. That will be occurring on Thursday and Friday. The other partners, though, this is great news, and this is exactly what we hoped for and anticipated. Each week we're adding more and different partners across the county who are getting direct allocations, who are able to be on the ground in their communities and their parts of the county and make sure that there's more access for COVID vaccine. In particular, I want to thank Reverend Childs, who's a member of our Vaccine Distribution Coalition. We'll be doing a joint pod site with him and several other community leaders at the Point of Praise Church this week. So I want to thank them especially for helping on that. And you can see our other partners, some of whom, like Neil and team at Village Apothecary, have been doing this for many weeks now, and other new, many of our local and long-standing pharmacies are now getting capacity, and that is great news as well. And of course, our hospital partners at Health Alliance and at Ellenville Regional continuing to do great work. So we're seeing, as the supply increases, more different channels and options for folks to get access. And I think we're finally, again, approaching a major inflection point. A huge piece of that, and I really want to thank New York State for stepping up, for answering our collective call, and for making this happen. The state-run vaccination site that we've all been hoping for and working for is being built as we speak at the Ulster County Fairgrounds. The state-run vaccination site that will stand up there is tentatively scheduled to actually open this Friday. And I want to thank all the team from the state, the county, and others that are working to get that site ready. I do want to let folks know that effective immediately, the Ulster County Fairgrounds is now closed to the public so that we can make sure we get everything set up and built out safely. I know I happen to live pretty close. I know many folks take advantage of the fairgrounds for walking and other things like that. Please be mindful. We'll be putting up signs. Those fairgrounds are now closed just for everyone's safety, and they'll remain closed through as long as the state-run pod site is running. The tentative hours, and this is all being finalized with the state as we speak, but the tentative hours for the state-run site will be starting Friday from 8 a.m. to 7 p.m. Appointments are not yet available on the state website, but they will be likely starting tomorrow. Again, I know that this is all in flux, but I want to share with you all what we know, given, of course, the importance of this. So as that becomes available, we'll continue to update everyone. Definitely by our next update on Thursday, we'll have a lot more final details, but I wanted to give the information that we do have. Once again, I want to really thank New York State. This state-run site will mean a dramatic increase in vaccine availability in Ulster County, and that is a big deal. It will mean access to life-saving vaccine, as we know, for many more of our residents more rapidly. And so, again, I'm really appreciative of everyone's efforts to make this happen, to build out the site and to run the site. We're looking forward to that. In terms of where we're at overall in our vaccination efforts as a county, we continue to make really good progress. And again, anyone that wants to can go to the New York State website. They update this daily as well. Currently in Ulster County, we are now just shy of 25%, just shy of a quarter of our population have now received at least one dose of vaccine. That's 44,252 residents that have received at least their first dose, and 18,727 that have received both doses. Again, that's 24.8%. The New York State average is actually 22.9. So Ulster County, through all of our collective efforts now, is actually above the state average, which is great. We're going to continue to push to do even better and even more. But it's pretty incredible if you zoom out for a minute. Across New York State, 4.57 million New Yorkers have now been vaccinated in just a matter of months. And I know it's been frustrating and challenging, and I know we have a lot more work to do, but that's pretty incredible, and that's due to the work of countless thousands of folks all doing their part, including all of the great scientists and researchers who developed this vaccine in record-shattering time. And of course, we've seen a dramatic increase in the availability of vaccine, the improved coordination under the new federal administration, under the leadership of President Biden. I can say definitively I have seen it here on the ground, and I want to thank them as well, and the whole federal team that's working this. We're finally all, I think, working well and working to make sure our residents are getting safe and rapid and equitable access to the vaccine. And we will continue to do that every single day. So in addition to the state-run site, which you sign up on the state webpage, we also still have our Ulster County portal. I know that right now that means that there are at least 2 different options. We're working to figure out how we can bring that together so it's a little more clean and simple. In the meantime, please bear with us on that. And if you are needing and wanting to be vaccinated, you can both sign up on vaccinateulster.com. That's our pre-registration list, as well as go to the New York State Am I Eligible page. Once again, I recognize it's not ideal that we don't have a single place. We're going to work to get a solution in place. But in the meantime, those are the 2 places that you can go, as well as those individual pharmacies that do have their own small direct allocations. So those are updates on vaccine progress, on COVID. The only other thing that I wanted to share, because lots of folks have been excited and interested about one of our most, I think, innovative and bold initiatives in the county, our Universal Basic Income pilot program, part of our Project Resilience effort to make sure that coming out of the pandemic, we're really helping everybody, but especially those that have been most affected, those families that have been struggling to keep a roof over their head, to have food on the table, to meet their basic needs and have a little bit of slack and breathing room for them and their families. And we're really proud to be the first county in the country to be doing a countywide universal basic income pilot. So we closed our application window that was open for 1 month from February 15th to March 15th. We closed it yesterday. We had over 4,200 residents apply, which is it's remarkable. It's, I think, absolutely heartbreaking that we have so many folks in such great need, and I know there are many more out there who could use this help. We know how many, even before the pandemic, were living paycheck to paycheck, far too many. So this is a small step to address that. The next step in our UBI program, and we'll be putting out a more detailed press release on this as well today, but the next step is in about 2 weeks, on April 1st, our partner who's running the pilot at the University of Pennsylvania Center for Guaranteed Income, they will be conducting a lottery to select the participants from those 4,200 applicants. We'll be selecting actually 200 participants. 100 will receive the benefit. 100 will be part of the control group for research and study purposes. And they will also be compensated to complete different surveys and provide information so that we can study the effects of the pilot and the benefits of the pilot that have been seen in so many others around the country. So exciting updates there. We're anticipating that once that selection process is done, we'll begin to be able to actually make the first payments to the participating individuals and families in May, most likely, and we'll continue to keep you updated on that progress and hope that it goes well, that it validates the idea that this is an important and innovative approach to helping our fellow community members, especially in such a difficult time. So I want to thank all our partners, especially the team at UPenn and my team and others that have been working on that, as well as all the community that actually contributed and donated. All of the funding for our program is from community donations at no cost to our taxpayers. So once again, really proud of that work and thank everybody. As we wrap up, as always, I want to thank all of our frontline workers, each of you for joining. I want to give a special shout out this week to our pharmacy workers, one of many groups and sets of folks on this list, but we're continuing to see, especially as vaccines are ramping up, how critical those teams are. We have so many of you doing great work at risk to yourselves to get our community vaccinated, running clinics all across the county. Many of you going to all corners of the county and even going to people's homes in some cases to help those that are homebound. So thank you to our pharmacy workers, not just for your vaccination efforts, but for ensuring that through this whole year we've had access to life-saving and critical prescriptions and medical needs and health needs. So thank you all for that work that you've done and all of our frontline workers. Our next update as we wrap up will be on Thursday at 3 p.m. We'll have hopefully more progress again and details on the state site. In the meantime, please stay tuned to your email or your phone if you are on our pre-registration list. We'll be sending out those sign-up links if you're on that, and if you're not, you can go to vaccinateulster.com, vaccinateulster.com. If you have any needs at all, you can go to our Recovery Service Center, 845-443-8888. We're almost through this. Please continue to hang in. Please continue to take care of each other. Be patient with each other. Be human and good to each other. And thank you for tuning in. We'll see you in 48 hours. Stay safe and healthy and resilient.